All right, so what do the orthobiologic treatment outcomes look? When you start looking at orthobiogen and using Regenix techniques, we are able to generate, one, we have a lot of data behind what we do. So as a network of providers, we're currently tracking at Regenix 6,141 patients. Okay, so let me say that again. Over 6,000 patients are currently being tracked for functional outcomes and improvement in pain levels. And that tells you how many, that's just a fraction of the total number of patients that have been treated. Because once a patient drops out, we don't count them as being active in the program for monitoring. And but we've done as a network tens of thousands of shoulder treatments. Okay, and this is specifically for patients that are undergoing what's called the SD procedure, utilizing bone marrow, which contains stem cells, and that is precisely injected using very specific protocols and expert care to put that in place. So here you can actually see, this is actually the latest data. I literally pulled this down today. You can see that it was updated very recently, April 18th. So fresh off the presses there. And these are the outcome data at 1 month, 3 months, 6 months, a year, and going out to 6 years. So what's fascinating is as you track this, boy, patients just keep getting better. And the outcomes for shoulders on orthobiologics are some of the best that we see in orthobiologics. I actually tell patients, I was telling a patient last week that I get excited when we see someone come in that is a good candidate and they've got, even a full thickness tear that's non-retracted. And, because we get great outcomes for patients in that situation, and they're looking to avoid surgery. And I'll tell you, the other thing is a recovery time, right? That's what a lot of you are looking for is, hey, I can't be, with what I do for a living, I cannot be in a sling for 6 weeks. There's just no way, right? I would have to shut my entire practice down and hope that I had, patients and staff to work here when I got back, because it's just not possible. So that's another part of the impracticality, of surgery that you have to kind of think about. But you can see those numbers, and this is, again, functional and pain improvement and patients continually getting better. And you just do not see this with traditional approaches.